Good day and welcome to today's webinar, Funding Opportunities in Multiple Chronic Conditions Research. This webinar series is coordinated by the Aging Initiative, which is an NIA-funded initiative that bridges the expertise and leadership of two powerhouses for research on multiple chronic conditions. The powerhouses are the Healthcare Systems Research Network and the Claude D. Older Americans Independent Centers, or PEPPER Centers. The initiative is led by Dr. Jerry Gerwitz at the University of Massachusetts NIA's Primary Care Institute, along with co-PIs at Adams and J. Magaziner. My name is Tulika Garg, and I'm a urologic oncologist and clinical investigator at Geisinger Health System, and I am part of the Aging Initiative Dissemination Workgroup, which is led by Heather Whitson at the Duke University Pepper Center and Leah Hanson at HealthPartners. Before we get started, I just want to cover a few technical details. Due to the number of registrants for today's webinar, we have placed phones on mute to reduce audio feedback. So unless you are logged in as a host or panelist, your line is muted. However, we do welcome and encourage audience participation using the Q&A or chat features of the webinar software. If you're in your Cisco webinar portal, look at the circles across the bottom center of the screen. Click the chat bubble icon until it is highlighted blue. And if you have questions for our speakers, please click on the Q&A tab on the right side of the screen and type in the Q&A box. We'll keep an eye out for these questions under the Q&A icon. And as permits, we will read questions for our speakers after the presentation. If you have technical or logistical questions, we ask that you submit those using the chat box that is above the Q&A box. Please ensure that you are identified by either name or participant ID so our webinar hosts will be able to help troubleshoot any problem you're having with audio or other issues. With the function, you can choose whether you'd like your comment to be visible to all participants, or you can choose to send the question only to the hosts. We extend a huge thanks to Catherine Anzoni and Chris DeLude at the Myers Primary Care Institute, who do amazing work behind the scenes to make these webinars possible. They will be monitoring the chat functions today to help with technical troubleshooting. Now I'd like to introduce today's three speakers. Gyasi Moscou-Jackson is a program officer for the Healthcare Delivery and Disparities Research Program at Patient-Centered Outcomes Research Institute. Dr. Moscou-Jackson manages a multi-million-dollar portfolio of comparative effectiveness research studies that compare health systems interventions intended to improve the accessibility and quality of care across a variety of clinical populations. In addition, she is a registered nurse with experience delivering clinical care in acute and primary care settings. Marcel Salive is a medical officer in the Division of Geriatrics and Clinical Gerontology of the National Institute on Aging at NIH and oversees the research grant portfolio on multimorbid treatment and prevention, polypharmacy, and comparative effectiveness, and has been involved in overseeing several pragmatic clinical trials in geriatrics. He has senior-level experience in multiple health agencies, including the Centers for Medicare and Medicaid Services, National Heart, Lung, and Blood Institute, and the Food and Drug Administration. And he previously worked as a senior investigator in the NIA Intramural Program. Arlene Bierman is the director of AHRQ's Center for Evidence and Practice Improvement. Dr. Bierman is a general internist, geriatrician, and health services researcher whose work has focused on improving access, quality, and outcomes of health care for older adults with a chronic illness in disadvantaged populations. Now, we'll speakers.
Thanks, Talika. So Dr. Salive is going to present first. You should see his slides in just a moment. And just a reminder to our speakers, once you have a little blue WebEx ball next to your name, you do have the ability to go ahead and share your slides.
Thank you for that one introduction, and I'm really pleased to be here, and thanks to the organizers. I I to present on the National Institute on Aging's funding opportunities for multiple chronic conditions research. And, so today I will cover the following topics: a little bit about an overview of the Institute and our wide-ranging interest in aging, certain types of research support that we offer, particularly of interest to this group, on development awards and the GEMSTAR program. Some words about the investigator-initiated awards program, which is really the bulk of NIA's portfolio and covers around 80 to 85% of our money for extramural grants. Finance and resources that can help get started on the process of applying for a grant to NIH. So this mission, as I said, is broad, and we do have a detailed strategic actions report on our website that details a lot of what we are interested in, although it is being updated at the moment. So that be in the next couple of years. But currently, and for many years, our mission has been to support research in a variety of areas on aging and different to that, to foster the development of researchers and clinician scientists, and to provide research resources for aging research, and to disseminate information to the public. So we have quite an array of topics, but today I will focus on the research mission. We do focus just old people, but also the aging process. So do changes in the over time in problems or possibly things. We focus also on age-related diseases and problems of the aged, such as, of course, multimorbidity, pharmacy, and the variety of geriatric syndromes. For our convenience, we organize NIA around 4 divisions. This is so that we can respond to potential grantees in these areas, but we definitely know that there are cross-cutting issues and interests that are of interest in multiple divisions. So sometimes this can just provide a starting point for what to look at NIA for advice from us. So we have behavioral and social research, aging biology division, which is focused more on clinical research and gerontology, and neuroscience, which has a heavy focus on Alzheimer's disease. In the division of geriatrics and gerontology, we have 3 branches, and I'm in the geriatrics branch, which is a large focus for most of the grants in the division. And certainly a lot of the multimorbidity grants are in that division, but we also have gerontology and clinical trials. So geriatrics is quite broad, and we do have an interest besides multimorbidity in many of these topics. So I will not delve into them much today, but I just wanted to point that out. Focus on multimorbidity partly derives from this research that we've seen on the prevalence of many chronic conditions with aging going up with aging, and then leading to the fact that multimorbidity is really more common than any single disease. So we do have quite a focus on multimorbidity in our division. And I said we do have a lot of other interests. Leave here for you to look at, but there are certainly disease-related, process-related aging, translational links between the biology and treatment, organ-specific and specific, even geriatric syndromes research. But I want to talk, I think a lot of people are interested in career development, so that this is one of the major programs, the GEMSTAR program, which is really a critical period in the faculty member in clinical research. And we have developed this program over time because we found out about this gap and really wanted to address it. There are later on many excellent programs after that, but we believe the GEMSTAR program addresses the need of early career development after the first faculty appointment. And it does provide some funding research, some opportunity to get mentoring and sort of a professional development program. So it was launched at NIA in 2011, coming out of some other, I believe, and uses this R03 mechanism, which is also now been adopted for some other programs that are more focused, do this thing, but do it for Alzheimer's disease. It is for specialists, so, but that is really defined as having residency training based on our eligibility criteria. We have now linked it to a biennial meeting that's science-focused but also provides mentoring across the GEMSTAR participants. So the RFA has a due date in next month, and more details can be found online through the link to the GEMSTAR program. And we're happy to discuss aims with people directly one-on-one, and so encourage that opportunity. GEMSTAR, we do have quite a long series of career development awards through the life cycle. And one of our top, most popular, and really one of our important NIA awards is the Paul Beeson 76 Award, which is for career development mentored with the clinical research, and now has two options for the FA, with either including or not including the clinical trial, and help you with doing that. There are several other career development awards here, but I need to, I think, press on to discuss the investigator-initiated awards. And these are the most common awards across NIH. I've mentioned the R03, which is more of a small grant program. We have the R21, which is exploratory developmental, and then the most R01, the research grant program. We do, and now several years, offer a program so that we can fund early stage and new investigators with R1s, and those points really apply to the R01, but they do really increase the success rate for new and early stage investigators to get that competitiveness and really get people started in their research careers. So there's some terminology that sometimes is confusing. I just wanted to kind of go briefly. A lot of people turn everything an RFA or request for applications. That is not the case, but usually that means is we have set aside money for that particular announcement, and it's usually narrow, well-defined, and has a single date. We have a special review for it. So then have program announcements, and we have a few types of those. PAR means they have a special review. So program can be, but it has a special review. And then there is a general announcement that has but generally will just get from the Center for Scientific Review and is funded from the common pay line. So the pay far right of this slide is really not have dedicated money, and so bear that in mind. But it is going against our pay line, which has been pretty of late. So, talk specifically about funding for MCC research, multiple chronic conditions research. We do, a lot of it is funded now through the investigator-initiated route, but we do have some specific fund announcements that are relevant that I wanted to highlight. And in particular, right now we have two large and now that are closing pretty soon. One is on a deprescribing network, and that is using a different mechanism, kind of an R24, which is previous aging initiative used that mechanism, so it's relevant to this audience. And then a clinical trial on statins, which is U19 cooperative agreement clinical trial mechanism. And those are very large, but I wanted to highlight them because I think we are trying to get research going in these areas at a level. Then on a more modest scale, the final bullet here talks about our program announcement on using existing data sets to address clinical aging research questions. And that's a very popular topic, and we have quite a few applications using this announcement on multiple chronic conditions. So recently, in the last 3 years, NIA has received quite a bit of dedicated money to study Alzheimer's disease. And so I wanted to just highlight some of the Alzheimer's work. And certainly we do have some announcements that have been out on Alzheimer patients with multiple chronic conditions. We have also focused a little on technology, delirium, other related topics, care, and the patients' specific care issues for them, palliative care, patients for care, and ways of communicating with the giver. So we have, if you on our site, we do have around 78 fundaments on Alzheimer's right now. So that is quite a bit more than what we have for anything else. It's about 3/4 of our active funding announcements. But I believe the funding ratio is around half our funds are for Alzheimer's and half are for everything else. So it says something about it. So I've given you some starting points, and I wanted to just briefly talk about a few and some websites that have good, useful information. Mentioned the NIA Grants website. There is a we'll give in a few minutes that talks about that, but you can now get on our listserv and receive the NIH Friday announcement of all the new grant funding announcements. There are specialty resources through specialty societies, especially GS. NIA has a bunch of resources that some are for obtaining old animals for research. There's also bases for that secondary database analysis I mentioned, and there are some Pepper Center resources which I think will be covered on future webinars. To find out what's going on, there are some conferences and workshops. There's an NIA blog, which I will also mention briefly. This is the website for finding out all the NIH grant announcements, and they're listed here, and it's very searchable, and it recently and shows 109 at the bottom here are to NIA. NIA currently has 109 active funding. And so that seems like a lot. So you can search within that and really narrow down your search to find things specifically. Then in those announcements, there are scientific contacts that you can call us or email us to get further information about whether a topic is of interest. And so we'll get into that as well. So a lot of the interests may cross-cut into NIA, and so there is the question of, should you talk to other institutes? And my answer is always yes, should, but figuring out which one maybe seems a little bit daunting if there's 27 other institutes. And, we have their websites, we have our websites, there's all kinds of things. I think one of the tools you can try is the Matchmaker tool, which is on here, and that is on the NIH website under Reporter. And if you used to know NIH Reporter, it was just for finding the abstracts of funded grants, but it now has this Matchmaker, which you can enter your text in this box at the bottom and press Submit, and you'll get some results that talk about what institute is a good match for your grant, activity code, if you're wondering about that, should it be an R1 or an R21? That's a little helpful, but it's more by the budget. And most importantly, perhaps, study sections match up closely to your research, and that's a good discussion point for the officer. A blog comes out every week on Wednesday, and I put in last week's because everyone loved the headline last week, increased pay lines ahead, and the website link here is shown, and you can enter your email address and then get onto our listserv, and you will get every Wednesday about the blog, saying interesting topics, not our pay line, but what else we're doing, and we see things going at the NIA. So I have a few final tips before I wrap up. You can force your grant to many people at your institution, but one thing that we recommend thinking is the opportunity to review for NIH. And so there is this early career scientist reviewer program is open to volunteers and can be viewed on this website, and be helpful to not single out as an early career person, by the way, but that you do not get the full load of 6 to 10 grants per round, but you start a little bit more manageable, make your way up to full reviewer through this program. So it's very good opportunities available as a volunteer. Finally, some low-hanging fruit. I think a lot of people are interested in the NIH loan repayment program. There are actually several programs. To check the website which ones might apply to you. One for clinical research, which I think is of high interest to probably people on this call. So we recognize the potential barrier of having to pay back a number of loans, and so this pays to $35,000 per year towards that burden that you may have. So I covered quite a lot of ground. I want to offer my services as a helpful person on your grant aims, and can view them with you by phone and discuss questions you may have. So, and my colleagues are also open to that as well. So we have, people in our division, and as I mentioned, other parts of NIA as well. But I thank again and turn it over to the next speakers, but we'll be around for questions at the end.
Dr. Salive. So we'll pass it on now to Gyasi, which looks like she's opening her slides up now, and should be good to get started.
Good afternoon, Gyasi Moscou-Jackson, Program Officer at PCORI. Thank you very much for having me today. During the next few minutes, I'm going to talk a little bit about who PCORI is, our investment in older adults and patients with multiple chronic conditions, and then spend a little time talking about our upcoming research opportunities and information about applying. So, PCORI, what do we do? PCORI is a nonprofit independent research institute that was authorized by Congress in 2010 under the Affordable Care Act. We're run by a 21-member board of governors that represent a broad range of individuals across the healthcare community. But as an organization, we're seeking to answer real-world questions about what works best for patients based on their circumstances and concerns, and we do that through comparative clinical effectiveness research, which is part of our legislative mandate. Our mission here is to really help people make informed healthcare decisions, and by people we mean our stakeholders. We do that by promoting high-integrity, evidence-based information that's from research guided by stakeholders in the healthcare community. Stakeholders are multiple and really are individuals with a vested interest in effective delivery of healthcare and healthcare systems. And those include patients and caregivers, as well as the advocacy organizations that support them. It also includes clinicians and health systems, all the way to payers and policymakers. And these different stakeholders help us in a number of ways. They help us to identify research questions that are of interest to our organization, or are high candidates for comparative effectiveness research, other special initiatives. But we also rely on them to review our applications and really help us determine which of these research questions has the most potential for impact, for a great impact. And expect that stakeholders are included within the studies that we fund, which I'll talk about shortly. So what is comparative effectiveness research and what do we fund? Really research that is comparing the benefits and harms of two or more different types of interventions, which can be clinical in nature or focus on a clinical condition in terms of preventing, diagnosing, or treating that condition. But it can also be an intervention that's focused on improving care delivery for those populations. Looking at pragmatic studies that look at real-world benefits to real-world populations, and to the extent possible describes how these particular interventions work best for some certain sets of subgroups of people that are specific and are considered important to that particular clinical condition or care delivery option. Ultimately, our hope that our research is going to inform decisions that health systems and any consumers really will make, and also to inform clinical policies and clinical decisions. It is really the development and testing of interventions, which also could include new decision aids. Also don't fund clinical guideline development, even though we're hoping research will impact on them. And also don't fund cost-effectiveness research, which is part of our legislative mandate. Our is guided by 5 national research priorities that were set from the beginning and program areas. One of them is assessment options. Research priority area focuses on those treatment options. Healthcare systems, which is part of my research program, is focused on clinical interventions that improve access and the efficiency of clinical care. The and dissemination and research priority area focuses on the how do you increase the uptake and dissemination of effective interventions. Addressing disparities focuses on comparative effectiveness research that will really interventions that will help to reduce disparities in what a population that is considered at risk. And we do have a number of populations that we consider risk for disparities. And then the final research priority area is accelerating PCORI research, which really focuses on methodology for patient-centered outcomes research. I'm going to talk to you about our research awards today, but we do have a number of types of awards that we've funded. In addition to research awards, we've funded engagement-related awards that are focused on improving and increasing engagement to lead to successful projects. We also focus on pilot, well, at least in our beginning, we have our pilot projects and projects that are focused. We have a couple of dissemination and implementation awards, which are new. But if I add up all of the awards that we've funded since the very beginning, we have funded more than 1,300 projects totaling more than $2.2 billion. And the state in which we don't have an investigator or institution that is currently the primary institution is North Dakota. So if you're from North Dakota, we definitely encourage you to apply so we can continue filling out the map. Why is PCORI interested in aging and multiple chronic condition research, and what have we supported to date? Really, our authorizing law that was part of our legislative mandate had a specific call out to fund research that would focus on health conditions and problems that disproportionately affect certain populations. And among those, for a number of reasons which you just heard, are that older adults are increasing, the number of them are increasing, and there is also a rising prevalence of multiple chronic conditions, which is definitely common among older adults. So that kind of falls within our interest based on our legislation. Also know that patients with one or more chronic conditions have significant health problems that limit their activities and independence, which is a particular problem among older adults as well. And then that's really important to them. It's obviously high burden illness, or they result in a high burden of illness that affects not only patients but also their families. And when they encounter the patients with multiple chronic conditions encounter the healthcare system, it's often fragmented. And so the research community or research world, a lot of times patients with multiple chronic conditions are not included in those clinical trials. And we, as I mentioned, we're interested in pragmatic studies that really address real-world populations. So it fits very much in line with our mission and fund. And also, we believe that issues that are faced by patients with multiple chronic conditions, as well as older adults, cut across all of our 5 national priority areas, which I just talked about. To date, as of August 2018, which I think we funded some more projects in November, or December, but we have funded more than, or at least 57 comparative clinical effectiveness studies that are specifically focused on and expected to yield results that would be relevant to patients with multiple chronic conditions. And as you can see in the chart, at least 18 of those studies are focusing on older adults with multiple chronic conditions. And the areas of care addressed across the multiple chronic condition portfolio, a fair number of projects, as you can see, are focused on treatment options, but there are also studies that are focused on prevention, and the other category of projects are really looking at integrated care models, so there just was no specific emphasis on a specific care continuum stage. It's sometimes useful to provide an example of the types of projects that we've funded. we consider comparative effectiveness research. And so this study here is by Dr. Donna Carden. And in the study, the team is looking at 2 emergency department discharge to community transition interventions for older adults who are critically ill, of whom their study now completed, although the results of them are pending. But they found that 83% of those patients who they included had 3 or more chronic conditions. So one of the interventions is looking at community-based social support and medical follow-up through a patient advocate. Other is just the usual practice of providing verbal and written instructions with medical follow-up to patients' provider. They were patients for 6 days with key outcomes, including quality of life, subsequent emergency department visits, and hospital admissions. And they, as well as we, are really hoping that the results of this study will be able to help health systems and the patients that they serve determine the type of services that are needed to successfully transition a patient from the emergency department back to their communities, as to provide patient-centered care during that transition. Another example by Dr. James Bailey. In this particular study, the team is comparing how well 3 different interventions, one being motivational messages that are 10 messages delivered by the doctor's office. Diabetes wellness coach is another intervention, and then visual care, which is the diabetes, general diabetes education information. But how well these 3 interventions work to African American adults with uncontrolled diabetes and at least one other chronic condition, how improves their diabetes self-care decision. In this study, they expect that at least half of the participants in each of the arms will can be older adults. Patients for 12 months and looking at key outcomes, including diabetes self-care decisions, quality of life, and hemoglobin A1C. And again, they, as well as we, are hoping that the results of this study will provide clinicians and patients information about the best approach to improving self-care decisions, which will in turn help achieve desired outcomes for patients with uncontrolled diabetes and other chronic conditions. So those are just different examples of interventions or comparative effectiveness studies that we funded, but again, they cut across multiple different research priority areas. The different types of funding options. For research, we have 3 different funding opportunities. Our broad funding announcement is our investigative-initiated studies, and I highlighted it because this is an upcoming opportunity. That particular cycle system will open on October 2nd with letter of intent due on November 6th, and all of our funding opportunities require a letter of intent prior to submission of a full application. But for this particular cycle, we're funding up to $3 million over 3 years, although we'll need to look at the specific area in which you're thinking about applying, because there may be slight changes to that funding cap. But that's the maximum that being offered across those different research priority areas. There may be also, or there will be really, some specific research questions that will be called out in each of the funding research priority areas, although for this particular funding announcement, again, it's investigator-initiated, so really anybody can propose a study. So if you have a particular study that you think would fit in comparative effectiveness research that's focused on multiple chronic conditions or older adults with multiple chronic conditions, you can definitely apply with that particular opportunity. 2 research opportunities that we offer from time to time but are not currently available is our pragmatic and targeted funding announcement. For the pragmatic announcement, it's a larger award, but we're really looking for research that focuses on CER priorities that have been designated by a large national organization such as ourselves, the Institute of Medicine, or AHRQ. And there you'll see a list of topics in there that we have and that we have already prioritized. And occasionally we'll also have targeted opportunities which are really answering a specific research question that will be designated in that particular funding announcement. But we urge you to check back regularly to see when these other two opportunities will be coming out. So what are the requirements for research funding for comparative effectiveness research through PCORI? I'm really looking for well-articulated comparators that are being tested, so they're very easy to understand what they are, and that helps with dissemination potential. Most of the studies we do fund are trials. We also fund using observational data, but it just has to be, justified with a rationale for why a trial is not the most effective or efficient way to study that particular question. So there are comparators, again, in addition to being really identified, they are also looking for comparing the effectiveness of them. So each of the interventions has to have established efficacy behind them. Hopefully in the area or on the outcomes that are being tested, or evidence for the outcomes that are being tested. Usual care is considered to be the most appropriate comparator. It definitely must be well defined because that varies. Usual care often varies from clinic to clinic or practice to practice. So knowing exactly what usual care is really important. Outcomes we're looking for have to be relevant to patients, but also to other stakeholders, because ultimately you want to make sure that this is something with dissemination potential, that there's outcomes that matter to not only patients, but also clinicians, systems leaders, as well as payers in terms of helping guide their decision about whether these interventions should be offered through them. Again, patients and other stakeholders should be involved in the research, and I'll explain more about that. And we also have a set of methodology standards that we have developed to guide our standards for conducting research, patient-centered outcomes research. So there's a couple of cross-cutting standards that would apply no matter what kind of study design that you're using. And then there are a couple that are specific to the study design, but we really expect that people are going to adhere to those standards because at the end, as I mentioned in the mission, we're looking to promote high-integrity research that's going to help inform decisions. And while the research opportunity is not intended to fund dissemination and implementation, we do expect that the studies have a potential for dissemination and implementation. Here's a list of the criteria that we use to evaluate studies. First of all, I'll say that our merit review panels, as I mentioned, are made up of patients, clinicians, and other stakeholders, as well as methodologists. And reviewing these applications based on these three sections. The first two sections, which is significance and approach, are similar to the NIH criteria. Other criteria that we have listed are patient-centeredness and and stakeholder engagement. By centeredness, we mean that this project is relevant and interest to patients and will answer questions that matter to them. And patient and stakeholder engagement, we are looking for how well patients and other stakeholders across the healthcare community are really involved on the research team, either as key personnel or just as stakeholders on an advisory panel, but that those particular stakeholders are involved in active and meaningful engagement throughout this study, from helping develop the questions to implementing the study and ultimately to disseminating the findings. Or I should say any research organization can apply for funding through PCORI, whether private or public, and also foreign organizations can also apply, but they must, research that's proposed, should be relevant and have a clear benefit to the U.S. healthcare system and patients, because we're ultimately interested in research that's going to be able to produce findings that will be of interest to people in the individuals in the U.S. as well as disseminated disseminated to individuals in the U.S. The only people who cannot apply are individuals. For all of our funding opportunities, you can go to PCORI.org/apply, and again, check back regularly to see what opportunities we have. And as you can see in the screenshot, we have a list of open as well as upcoming opportunities. So a few months in advance, those opportunities will start to appear on an upcoming tab. And if you have any questions about your particular research idea, we always encourage you to reach out to us. And your question will be triaged to the most appropriate program for the research priority area for the question you're interested in studying. And a program officer is always happy to talk through your specific example. So again, for having me on this webinar, and hopefully I've provided you with useful information.
Thank you so much. Pass the ball on to our next presenter now. Let her share her screen in a moment, and I'm just going to go ahead and unmute her. And a reminder, share the screen. There should be a menu at the top of your WebEx event window. Be a tab that says share, and you can hold that down and go over to my screen. And then come up. It looks like we can see your desktop, but I don't see your slides yet.
Can you see them now?
No, not yet. Desktop.
Oh, this thing, I have it. Let me move it over to my other, I have two screens. Hold on a minute. It might be sharing the wrong screen. Just a minute. Oh, it was on the wrong screen. Sorry about that. Okay, you're not seeing, are you seeing now?
You can see it now, but if you want to make it a little bit bigger, that might be easier for folks to see if you go to the screen.
Yeah, no, for some reason it's, okay, this is odd. I'll just share my other screen because it's, trouble here.
Go to that same menu at the top where it says share my screen. If you have the two screens, it should give you the option for screen 1 or screen 2, and just the opposite one from which one you're on right now. Or update it in PowerPoint in the tab that you're in.
It's funny, the slideshow is showing on one screen, and smaller ones are showing on the other screen. So let me...
Well, in the tab you're in now in PowerPoint, there's that little monitors option where it says show on primary monitor. If you change that to the secondary monitor, it should fix the issue.
Oh, okay, thank you.
And then try to, share it bigger now that it's on the other screen.
Okay. Do you have it now?
Yeah.
Sorry about that. That's having two screens. So, just to start off, I'm going to give you a brief overview of AHRQ and really spend most of my time talking about a whole range of funding opportunities that we have. So AHRQ's mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work with HHS and with other partners to make sure that the evidence is understood and used. We have a big focus on dissemination and implementation research and implementation science. So how AHRQ contributes, that AHRQ invests in research and evidence to understand how to make healthcare safer and improve quality. Health services research AHRQ creates materials to teach and train healthcare systems and professionals to realize improvements in care. AHRQ generates measures and data used to track and improve performance and evaluate progress in the U.S. health system. In where we sit within HHS, you heard from Marcel about NIH and their priorities. CDC focuses on population health. CS is a payer, and AHRQ really does the research to help healthcare systems deliver safe, effective treatment. And I think our biggest distinction between AHRQ and NIH is that we're patient-centered rather than disease-specific. We know it's not quite true for NIA. But so that MCC, because most people do have multiple chronic conditions, or most older adults do, really is cross-cutting through our whole portfolio. And I'm going to provide some examples. At AHRQ, I sit in the Center for Evidence and Practice Improvement. This center, which was created in 2014, and the purpose of our center is to generate knowledge, synthesize evidence, translate science on what works in healthcare delivery, and catalyze practice improvement across healthcare settings. And we have 4 divisions. We have an EPC program that does systematic reviews. We have U.S. Preventive Services Task Force program, which makes recommendation on clinical preventive services. We have our Division for Health Information Technology, where there's many opportunities for funding, and our Division for Practice Improvement, which also includes patient engagement and shared decision-making. We also house the National Center of Excellence in Primary Care Research. So consistent with AHRQ and CEPI's mission, AHRQ is interested in grants for multiple chronic conditions that demonstrate the effectiveness of synthesizing, translating, and communicating complex scientific evidence, discuss, test, and spread techniques for healthcare practice improvement, ambulatory care setting, in particularly interested in older adults in the community, including accelerating the implementation of evidence-based practice, improve healthcare quality through the use of information systems and data resources to support clinical and organizational improvement. I just encourage you to go to our funding page, which has a wealth of information of current funding announcements, our priorities, as well as our training awards. And I'm going to go into some more details about these opportunities. We use same funding mechanisms and same review criteria as NIH. And you can see here we the list of research grants that we have. And in response to standing program announcements, we'll say which ones are available for different areas of interest, as well as our career development program. I'll give you some more information on that as well. So we funded a multiple chronic condition research network that is, the grants from that have finished, but there's multiple resources on our website from that. And the work of that network is really foundational, and we've been building on it in terms of our MCC portfolio. And these grants aim to improve understanding of interventions that provide the greatest benefit to MCC patients, safety and effectiveness of interventions that may be affected by multiple chronic conditions, and interventions that might need to be modified for a specific patient population. And on our website, there are summary grant profiles of all of the work that was done under that portfolio, as well as some research data sets that are available for public use. AHRQ has the resources, so we have a number of databases which are really rich for research on older adults, including, and people with MCC, including the Consumer Assessment of Healthcare Providers and Systems, CAPS, which is a patient experience survey, Healthcare Cost and Utilization Project, which has administrative data, claims data on most of the hospitals, emergency rooms, and many ambulatory care surgery centers across the U.S. I just released today a stat brief on use of opioids in the elderly that was done opioid-related hospitalizations and emergency department visits, and it turns out that over a third had 6 or more chronic conditions. So there's wealth there. We do the stat briefs as descriptive, hypothesis generating, and clear those data sets are available for analysis, as is MEPS, our Medical Expenditure Panel Survey. National Center for Excellence in Primary Care Research, we're very interested in the care of older adults in primary care settings, as well as their integration with the rest of the health system and the community. And our CEPC, our website, actually has a host of resources for researchers. If you go to Tools and Resources for Research Quality Improvement and Clinical Practice and click on that, researchers can find many resources to help them do research based in primary care settings. So, a number of funding opportunities. We have a special emphasis notice on optimizing care for people living with multiple chronic conditions through the development of enhanced care planning. And here we have a specific interest in generating knowledge of how clinical teams will use patients' values, preferences, and personal, social, and clinical context to formulate and use plans of care in partnership with patients, caregivers, and families. And so there's a number of funding mechanisms for that, including R01s, R03s, and R18s, and more information is available on the funding website. Another special emphasis notices that are available that really fit well with people with multiple chronic conditions is one on advancing the collection and use of patient-reported outcomes and patient contextual data to improve quality and outcomes of care, health information technology, interest in innovative research in primary care, including care of complex patients and those with multiple chronic conditions, research that uses shared decision-making as a tool to improve quality of care for low-income and racial and ethnic minority patients. So you see AHRQ look at funding announcements through the lens of people with MCC and older adults, and you'll find that because it's so cross-cutting, many of our funding announcements will apply. We have a new special emphasis notice on opioids that specifically calls out understanding and addressing the rapid increase in opioid-related hospitalizations among older adults. I have all of the links to get more information about these funding announcements. FOA, which was actually just released Friday, screening and management of unhealthy alcohol use in primary care. And I'm sure everybody on the webinar realizes that, there's specific issues around unhealthy drinking in older adults because of drug-drug and drug-disease interactions. And there's an emphasis in there on needs of different patients across the life course. And we're really interested in getting applications that focus on reducing harmful drinking in older adults. For an example, other opportunity announcements using health information technology to scale and spread successful practice models using patient-reported outcomes, which are key for people with multiple conditions, developing measures of shared decision-making, establishing, scaling established clinical decision support, and developing new clinical decision support. There's also a suite of funding announcements around patient safety, which specifically would address the needs of older adults who are at higher risk and people with multiple chronic conditions, looking at safety in ambulatory care settings and long-term care settings. We have growing emphasis on diagnostic safety or diagnostic error in ambulatory care, and we all know that that's a major issue for people with multiple chronic conditions for multiple reasons. And also understanding strategies to improve diagnostic safety and reduce diagnostic errors, and also medication research to focus on safe use of drugs. I'm going to switch gears here, and we also have a whole process. We're tasked with implementing patient-centered outcomes research widely. We have the alcohol way that I just shared is part of this process, but anybody could nominate topics, and then we examine them for the strength of the evidence. But there's gaps in care of patients with MCC, and there are, strong evidence for interventions that make a difference. Please nominate them, and we will consider them for a funding call. So I'm going to talk a little bit about our training opportunities, and we have training and career development grant opportunities for pre-doctoral, postdoctoral, and also K awards. So dissertation grants support dissertation researchers focusing on health services research, provide 9 to 17 months of support, and applicants must be full-time students, and you have there the deadlines for applications. A number of institutions have institutional training awards from us, T32s, that provide funding for both pre-doctoral and postdoctoral training, and it provides stipends and partial tuition coverage. And you need to, our website is a list of institutions participating. Some of you may be at these institutions for applications. Again, we now have an F32 postdoctoral fellowship. This is new. Support training of postdoctoral researchers to become productive and independent researchers, and it provides up to 3 years of support, stipend, and other fellowship expenses. And these are for people who already have a PhD, MD, or equivalent doctoral degree. We have our K awards, which provide an intensive and supervised research and career development experience in preparation for an independent research career. And I'm not going to read all the details, but they're 3 to 5 years non-renewable, and they require a 75% minimum effort. So currently we have the K08 and K01. Information, we have our training website that will, if you're interested in applying, will give you more information about those. So in general, I'm going to end with tips on getting started. So proposed aims should be unique to AHRQ and in line with AHRQ mission and priorities. And there's online, they've renamed the gold base to PROD, but there's a database if you want to look at the kind of things we fund if you're not sure. And all of our program announcements and SENs have a name of a program officer on them. So we're always happy to talk to you if you want to see if something is a fit or not, or get some advice on your applications. So thank you.
Thank you.
A huge thank you to all three of our speakers, Dr. Salive, Moscou-Jackson, and Bierman. What great information about your organizations and funding opportunities in multiple chronic conditions research. All of the presentations are now open for questions. As a reminder, put your questions through the Q&A function in WebEx. Looks like one question during the webinar, and we'll start with those, but if you want to start typing your questions, that would be great. So this question, it looks like, Dr. Moscou-Jackson, you answered it written, but it would be great to do that verbally. So the question is, in regard to pragmatic clinical trials with solicitation in 2019 or later, how dependent is this on the future of the ACA?
Good. And again, I was thanking the individual for the question. This is a bit of a tricky question to answer. I mean, we don't really know what's going to happen in terms of whether or not we'll be, reauthorized and continue to receive funds yet. But what I can say is that we make an award available for people to apply, and we actually fund awards under it. We will be able to fulfill our commitment through the money that we do have in our PCORI Trust Fund, which is monitored very carefully to ensure that we're able to fulfill our commitments. And we also, when we're putting together the awards, make determinations about how much money and how long based on. But at this time, we don't really know yet. I'm sorry to answer that question, but what I can say is, again, is that if you are awarded an award, you will be able to fulfill your commitment, or we will be able to fulfill our financial commitment to you.
Thank you. Next question sounds like it's for Catherine. Can you comment just really about access to slides and any links to recording?
Sure. So if anyone does want a copy of the slides, I can make a PDF available to folks by email. We also do post the recordings and the PDFs of the webinars on our website. So if anyone wants to be directed towards that, please let me know. I can send that information in.
Great. While we're waiting for more questions, I'll ask a question to all three presenters. I'm wondering if each of you could comment on what are some common pitfalls that new investigators run into when they're applying for grants. If you have any, you've all three hit on some tips and FAQs, but if you comment specifically on pitfalls, that would be great. Dr. Salive, do you want to start?
Okay, sure. It's a whole talk, but why we want to have a discussion about some aims. I think a common pitfall is overly ambitious aims that can't be completed in the time available. So you need to really show your aims to a lot of people and discuss, some of the specific issues, I believe, and really get a good match that the work accomplished in the allotted time.
Oh, keep it real. Have realistic expectations. Doctor, did you have any pitfalls that you see?
I think Marcel's point was well taken, that people are overly ambitious, I think. But the other thing is make sure that you're a good fit for the funding opportunity and the agency or institution that you're applying to. So you could have a great application, but if it's not quite a good fit for our aims or goals, it helps. So I think really feel free to contact. That's what the program officers are for, is to really look at what you're submitting and making sure that, it's on target and it's a good fit, or give you some advice about what would be a better fit. And the other thing is to just really have a thick skin. Most things don't get, funded on their first round, and even for the senior experienced investigators. So, take the feedback to heart and, just, press on and resubmit.
Okay, thank you. Moscou-Jackson, did you have anything to add?
That oftentimes maybe it's a matter of investigators not quite understanding exactly what kind of research that PCORI funds, and so they don't propose comparative effectiveness projects, which can either be they're proposing a project that is developing intervention, or they're, the interventions that they're planning on testing, comparing haven't exactly been tested, or they haven't really provided enough evidence that it has been tested in other or a particular population, ideally, or in other populations or settings. Another pitfall, I guess, that people tend to fall into is that the first criteria is significance in terms of filling critical evidence gaps or being able to be adopted into practice, and so sometimes it's not clear to us in the letter of intent phase as well as to reviewers during the review process this study is truly important to patients first and most, but also is going to fill a critical need in a critical gap in evidence with a high likelihood of being able to be adopted later.
Advice. Well, those are all the questions we have for today. I know, Catherine, do you see any questions? I don't, but those are the ones I see.
Can I make a comment, a final comment?
Please.
This is Marcel Salive. So I did want to just point out that the NIH does fund cost-effectiveness research, and so we heard from PCORI about their from that, but we do fund it at NIH, so bear that in mind, and also do fund pragmatic trials and cost-effectiveness add-ons, I believe, to PCORI studies. So we're happy to discuss that with potential investigators.
Great. I've received one more question. A thank you for the presentations, and then asking specifically about the AHRQ postdoc and career award funding are open to international applicants, for example, from Canadian research institutions.
Unfortunately, no. It has to be from a U.S. institution for AHRQ.
Okay, fine.
For NIH.
Are there final comments from the speakers? Okay, a little early. Thank you again to our speakers, and thanks for all of you for attending our webinar. We appreciate questions and the conversation. Have a good afternoon, everyone.